Why your blood pressure stays high, even when doing everything right. Let me start with something I tell my patients every single week. Just because your blood pressure is high does not automatically mean you're doing something wrong. In fact, some of the most frustrated patients I meet are the ones who seem to be doing everything right. They walk every day. They eat reasonably well. They don't smoke. They rarely drink alcohol. They've reduced salt. They've lost weight. And yet, every time we check their blood pressure, the numbers are still high. Not once, not during stress, but consistently. Eventually they ask the same painful question. What am I missing? Is my body broken? Or is this simply what happens when you get older? If you've ever felt that way, I want you to hear this clearly. High blood pressure is not always a sign that you failed. Sometimes your body is responding to signals happening beneath the surface that most people never hear about. And understanding those signals may completely change the way you think about blood pressure forever. Because while salt matters, exercise matters, sleep matters, there is another piece of the puzzle that deserves attention. That piece is insulin. And today, we're going to talk about why insulin resistance and metabolic health may be playing a much larger role in your blood pressure than you realize. But before we continue, it's important to say this. High blood pressure has many causes. Genetics can play a role. Aging can play a role. Kidney disease can play a role. Sleep apnea can play a role. Stress, medications, hormone disorders, excess alcohol, obesity, and high sodium intake can all contribute. There is rarely one single cause. Instead, blood pressure is usually the result of multiple systems working together. And one of those systems involves insulin. Most people think insulin only matters if you have diabetes. But insulin is actually one of the body's most important metabolic hormones. Its main job is to help move sugar from the bloodstream into cells where it can be used for energy. But insulin does much more than that. It also communicates with your kidneys. It influences your nervous system. And it affects how relaxed or tight your blood vessels become. When insulin rises after a meal, that is completely normal. Your body handles the nutrients you just ate. Then insulin gradually falls back down. That cycle of rising and falling is exactly how the body was designed to work. Problems can develop when insulin remains elevated for long periods of time. This is often called insulin resistance. In insulin resistance, the body needs more insulin to accomplish the same job. Blood sugar may still look normal for years, but insulin levels can quietly remain higher than they should be. And this matters because elevated insulin can encourage the kidneys to hold on to more sodium and water. More retained fluid means more volume inside the blood vessels. And more volume often means higher blood pressure. At the same time, insulin resistance may increase activity in the sympathetic nervous system. You can think of this as the body's fight or flight system. When this system remains slightly activated all the time, the heart works harder and blood vessels stay slightly tighter. Neither of those things help blood pressure. Now let's look at a very common day. Breakfast at 7, coffee with cream and sugar at 9, a snack at 10:30, lunch at noon, an afternoon snack, dinner at 7, dessert at 9, maybe a smoothie somewhere in between. None of these foods are necessarily unhealthy. In fact, some of them may be excellent choices. But metabolically, every eating event asks your body to release insulin. Again, this isn't automatically bad. The question is whether your body gets enough time between eating periods to return to baseline. For some people, especially those with insulin resistance, frequent eating may make that difficult. This doesn't mean everyone should stop eating snacks. It doesn't mean everyone needs fasting. It simply means meal timing may matter more than many people realize. Another surprising reality is that body weight does not tell the whole story. Many people assume that if they are thin, they must be metabolically healthy. Unfortunately, that's not always true. There are two major types of fat in the body. The first is subcutaneous fat. This is the fat under the skin that you can pinch. The second is visceral fat. This fat surrounds internal organs like the liver and pancreas. Visceral fat behaves differently. It releases inflammatory chemicals. It interferes with insulin signaling. and it is strongly linked to insulin resistance and cardiovascular disease. The surprising part, some people with normal body weight still carry significant visceral fat. From the outside, they look healthy, but metabolically, their bodies may be struggling. This is one reason doctors sometimes see high blood pressure in people who are active, lean, and otherwise healthy appearing. Now let's talk about mornings. Many patients tell me, my blood pressure is always highest when I first wake up. There are several reasons this can happen. One is a normal hormonal event called the morning surge. Our bodies naturally increase certain hormones before waking up to prepare us for the day. But poor sleep, sleep apnea, alcohol, late-night meals, and insulin resistance may amplify this effect. This is one reason sleep quality deserves much more attention than it receives. If you snore heavily, wake up tired, or feel sleepy during the day, discussing sleep apnea screening with your doctor may be extremely important, because untreated sleep apnea is one of the most overlooked causes of resistant high blood pressure. So what practical steps actually help? The first is to focus on meal quality. Prioritize vegetables. Choose lean proteins. Eat high-fiber foods. Reduce ultra-processed foods whenever possible. The second is to avoid constant grazing if it doesn't work for your body. Many people benefit from allowing several hours between meals instead of eating continuously throughout the day. The third is to avoid large meals close to bedtime. Giving your body time to digest before sleep may improve both metabolic health and sleep quality. The fourth is movement. Walking after meals can significantly improve insulin sensitivity, and you don't need marathon training to benefit. Even a 10 to 15-minute walk after dinner can make a difference. The fifth is sleep. Poor sleep raises stress hormones, worsens insulin resistance, and increases blood pressure risk. Aim for 7 to 8 hours of quality sleep whenever possible. And finally, don't underestimate stress. Chronic stress keeps the nervous system activated. The body was designed for short bursts of stress, not constant stress all day long. Sometimes managing stress is not a luxury. It's part of blood pressure treatment. Now here's the message I want you to remember most. High blood pressure is not simply a salt problem, but it's not simply an insulin problem either. It's usually a systems problem. The kidneys, the blood vessels, the nervous system, hormones, sleep, nutrition, movement, stress, all of them work together. And that means improvement can happen from multiple directions as well. Small changes done consistently often outperform extreme changes that last only a few weeks. If your blood pressure remains high, despite your best efforts, don't assume you're failing. You may simply need a more complete explanation, and you deserve one. Work with your healthcare professional. Track your numbers. Stay curious. And remember this. The goal isn't just lower blood pressure. The goal is protecting your heart, protecting your brain, protecting your kidneys, and giving yourself the best chance of living an active, independent, healthy life for decades to come. If you found this information helpful, consider subscribing and sharing this video with someone who checks their blood pressure every morning and wonders why the numbers still aren't moving. Because sometimes the missing piece isn't effort.